When you look at some of the things doctors of the past encouraged for infections, it's unbelievable. Like putting sulfur in your shoes for the flu, or rubbing a kerosene and butter mixture on your chest for a sore throat, or bloodletting for, well, just about anything. It's kind of hard to believe that our ancestors survived so many illnesses. Nowadays, we have a very powerful tool, a tool discovered and utilized by science rather than superstition, a tool called antibiotics.
So an infection can be caused by a number of things, and one of the two most common things we talk about are bacteria and viruses. And there's actually a pretty important distinction between the two. A bacteria is a microorganism like E. coli or staph. Those are some that patients might be familiar with that cause infection.
Antibiotics are a class of medications that stop bacterial infections by either killing the offending bacteria directly or by inhibiting their growth and reproduction, so our immune system can take over. When bacteria are killed or stopped, the body can heal itself and can get over the infection.
A virus is an actual microbe that doesn't really do a good job of causing infection unless it invades a healthy cell, human cells, animal cells. When it does invade the cell, then it basically takes over the cell's ability to reproduce, and that's how it causes infection. The distinction is important because antibiotics have no effect on viruses. They only have effect on bacteria. And there's no role or no benefit for antibiotics in viral infections.
Unfortunately, antibiotics are so effective at treating our illnesses that we've become overly dependent on them. Just about everyone knows to ask their doctor for an antibiotic, and antibiotic use is starting to become antibiotic misuse, which is raising some health concerns within the medical community.
So antibiotic resistance is when a bacterial organism develops the ability to resist the effects of the antibiotic. So it's actually a normal evolutionary process. Bacteria are living organisms that want to find a way to survive. And the way that they do that is they will develop ways, whether it's through genetic mutation or other mechanisms, where they're able to actually resist the effect of the antibiotic. What that means is the antibiotic won't work, and it won't eliminate the bacteria or kill off the bacteria.
Think of it like a bacterial training camp. When we take antibiotics, it's like giving innocent, non-threatening bacteria in our bodies an inside peek at what they will be up against should they ever turn infectious. So they adapt their personalities, their structure, their game plan, if you will, in order to stand a chance against antibiotics in the future. When you're actually sick and in dire need of antibiotics, this isn't a concern. The benefit of the antibiotics getting you through the illness far outweighs the risk of buffing up an as-of-yet non-threatening bacteria. It's when people start using antibiotics when they don't need them that this little training camp becomes a threat.
Most illnesses, upper respiratory infections, colds, flus, are due to viruses. And as a result, antibiotics have no effect in treating the viruses. So what happens is you end up taking an antibiotic essentially for no reason. It's not having an effect, and it can actually cause you harm. It can cause the patient harm.
Bacteria that develop antibiotic immune personalities are often referred to in the media as superbugs, and we see more and more cases involving superbugs every year.
So what happens is the infection becomes more difficult to treat. It's dangerous to start with stronger medications because what you're doing, using the antibiotics repeatedly and using stronger antibiotics, accelerates the process of resistance. So antimicrobial resistance is happening naturally in the environment and in the community. Using antibiotics frequently, using very strong antibiotics, accelerates that process. So now you're having more and more microorganisms in the community that are harder to treat.
Even so, doctors say that most people will never encounter a superbug, and even if they do, most healthy people survive. So then, the key is to maintain your health and fortify your immune system all year long and not rely on an antibiotic that may end up doing you more harm than good.
So when taking an antibiotic, first and foremost, you should always take it as directed. If your physician tells you to take the antibiotic for 10 days, take it for 10 days. In addition to that, if you have, for whatever reason, antibiotics left over from a prior infection, you should never use that antibiotic to treat a new infection. Another thing that is important is you should never share antibiotics. A friend becomes ill, you have some left over from one of your prior infections, and you give it to a friend of yours. Not wise to do. You should also never pressure your doctor into giving you an antibiotic if your doctor does not think it's indicated. Even if you feel like you need an antibiotic and you think an antibiotic will help your symptoms, it's never a good idea to pressure your doctor to prescribe it.
If you really feel the need to take something, real candy, in the cases where antibiotics are not recommended, is better for you. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.